So ACL tape job, first off, heel, tape under the heel. I'm gonna normally spray with a tough skin. Not gonna do that today. Start about mid quad. We're gonna work our way down. Biggest thing, when you are actually doing the taping, you wanna make sure you get high enough and low enough. A lot of people will try to go too high, too low, or I'm sorry, too not low enough, not high enough. So about mid quad. Then, big thing when you go to putting your elasticon on, I always recommend them shave their leg a little bit. You want a little bit of a strip over the pre-wrap. We're gonna go as light as we can on poor John here today. So big thing too, as you're coming in and you're compressing, say, give me a little bit of flexion in that muscle. So it's not a whole lot. It doesn't have to be like Arnold style, but I want a little bit of muscle tension there. Laying down, great. But we're gonna probably come in, depending upon the body size of the athlete, we're gonna do 2 to 3 at the top. I want about 50% coverage over them. That's a good area. That gives me some space to protect the patella, not get too much on the patella. I honestly would maybe go a little bit lower on him. Not terrible, kind of all is dependent upon my athlete. So I've got enough space there where with my cross strips, I'm gonna have enough space to stay off the patella. So then on the bottom side, I'm gonna come down here, get a strip around. I'll go a little bit, kind of same thing. Big thing with the calf is, again, have them give a little bit of a tighten their calf so that they feel like they don't get too tight on it. I don't go as much compression on the calf. Oh, I should have just torn that one. So from there, then you've got your basic layout of any knee tape job that you want to start with here. Now, depending upon what you're looking at, ACL, PCL, MCL, LCL, I will typically, in the primary ACL, I'm typically going to add in some LCL, MCL as well. So LCL, I'll throw on three strips. Make sure, again, staying off that patella. We're going to come down across, get a little tension across. Now, depending upon if the individual has a LCL as well of an ACL, or if it is primarily a LCL or primarily an MCL, I'm going to come down and I am potentially going to add in some some leukotape over the top of that area. So those two, I put a little bit of tension on, not a ton of tension, and then I will come in and I'll get a little bit more attention on that straight up and down through here. So like so. And then this is where if I really wanted to add in some strips with some leukotape, I could add in leukotape strips. Now, I'll do the exact same thing here on the medial side. You're good, I'll work around you. So coming across that MCL, again, don't bind too much in the back. When you're talking rodeo guys, focus on, depending upon what your event is, what the movement pattern is. Bronc riders have to really get deep flexion. Bareback riders, depending upon how they ride, their mechanism of how they ride. Due to the fact, where do their knees come? Do they have to bring those knees up, and do they feel like then they're prevented? They get, whoa, I'm moving the table, that's what I'm doing. Do they feel like they get bound up in the back, and do they not get as much knee flexion as they need? So that's the biggest thing there. Make sure you don't get too much stuff back here that makes them not be able to then get their knee flexion like they need it. And when they have problems with knee flexion, then what happens is now that completely throws off their riding, and it makes them over flex in their hip and start rounding in their back and pulling in their back, especially in like bareback riding. In the bronc riding, it makes their feet not move together, and it makes them not be able to kind of basically be in rhythm with the horse, and it completely throws off their movement pattern. So then we'll do this one big medial strip. A little more, like I said, pull on that straight up and down one. Again, just like on the lateral collateral side, you can add, if they have a true MCL injury, you can come in here and you can add some leukotape, maybe even some hard white tape if you wanted to. So now, the thing with the ACL, PCL, So always a reminder of how to do this. What does the ACL do? That is that anterior shear or forward pull. So we want to prevent that forward pull for the ACL. So how we're going to be from the backside here, coming down, strip from here, pulling down to the front side, that's preventing anterior. Same thing will be on the front side, preventing anterior pull. On the PCL, it's going to be the exact opposite. PCL from the top side, coming down across the back, preventing posterior glide, from the back side, coming to the front, preventing that posterior side. So for this one, this is the ACL. We're going to come in, basically do this. I'll always place the strip here, about mid-thigh. Okay, go ahead and take your fingers, hold that for me. Gonna give it a little bit of pull, basically about the length of the tape job. Come up. Give myself, actually we're doing an ACL, so we're gonna come here. About mid. I will usually throw in an ACL and a PCL on all of these anyway. But, so Don, if you can reach down there, hold that for me. We'll come up, rip it down the center. When you rip it, then lay it gently. Don't come in and try to put in a lot of force and a lot of pull with that, or they will roll. So that's your big thing. That's going to prevent that anterior pull. I'll then come in on the back side, do the exact same thing. Go ahead, you're fine. So I'm going to put it here on the front side to cut it. Then come back here. John, if you can hold that for me. And split in the middle, same thing. Don't put a ton of tension on this. Again, remember that bind in the back of the knee. Come down and across. Now, my big thing I add on that is I add a little bit of tension pull. I'll pull that up, and then I'll put my tension into the tape job right here, just like that. So that's where I get that tension out of the knee, that slack. I'll throw always one on the opposite direction from where I'm coming. That's where we're gonna come in, throw this guy in, hold right there for me. Split to the center again, coming down. Focus on lay these down. Again, don't bind in the back. Now, last thing, pull that slack, coming up, pull that slack here. Nice position, really stick that tape down, okay? So now that's the buildup of your ACL with one PCL. Now, as you come, depending upon how the person rides, what the sport is, what the event is, this is how I base my movement pattern. If it is a bareback rider that rides pulling his knees to his shoulders, I'm going to rotate out. I'm going to have him rotate his feet out, toes out to where he gets to. Same thing in the bronc riding. Bronc riding, I'm going to rotate depending upon how their knee movement is. In bull riding, I'm going to ask them if they ride more with their feet or if they ride more with their knee, depending upon which direction I need to pull them. So it's all protective of what the injury technically is, but I'm going to assist in the movement pattern that I need them to be able to pull into. So we'll say John's a bareback rider. John turns his toe, makes sure turns that toe out. It's like he's going to be pulling his knee to his shoulder. As we do that, what I'm going to do is I'm going to, depending on the direction, I don't want to pull him in here. I want to kind of pull him out. So I'm going to go ahead and go on the outside, pull a little across here, which is going to protect him again. Same thing. Don't bind in the knee, in the back side of the knee. Come down, cross, give that good wrap. And this is all based on how he feels in his movement. Some guys I may move to more of a medial pull, also depending upon whether there's more MCL, more LCL involvement, something like that. That final barber pull wrap is a case by case on each person. But then take that off, they should be able to pull their knee up, go into pretty well normal range of motion, especially once it loosens up and once they start able to move, but they have that good stability of that anterior door.